When I said, I've been feeling too anxious lately and I need help, the response I heard were, you should be able to control it if you try hard enough. What if you get addicted to the medication? Having a psychiatric report could be risky. These reactions reflect the stigma that still surrounds psychiatric treatment and medication. Research led by Dr. Ahmed shows that stigma around mental health and psychiatric care is one of the biggest barriers to treatment worldwide. Stigma delays care, it discourages people from seeking help, and it often allows symptoms to worsen before support is ever reached. In many cases, fear of psychiatric medication causes more harm than the medication itself. At the same time, modern life keeps the nervous system on high alert. Deadlines, debt, competition, notification that never stops. Together, they create an environment where anxiety is expected. As pressure increases, more people are diagnosed with anxiety disorders, and more people are prescribed medication. So let's talk about anxiety medications. How do they actually work, and what are they really meant to do? To answer that, we first need to understand what anxiety actually is. Anxiety itself is a normal response to stress. In mild amount, it can actually be helpful. It keeps us alert, focused, and prepared. However, an anxiety disorder develops when this system becomes excessive or persistent and begins to interfere with daily life, including work, school, sleep, and relationships. As anxiety is driven by the nervous system, its symptoms shows up throughout the body. Many people experience cognitive symptoms like constant worries and sense of impending danger, or behavioral symptoms including difficulty in concentrating, trouble sleeping, and avoiding situations that triggers anxiety. Interestingly, physical symptoms also show up, including increased heart rate, rapid breathing, sweating, muscle tension, and feeling weak or exhausted. When anxiety starts to take over daily life, anxiety treatment can help restore balance. And treatment typically works on multiple levels. One of the most effective treatments is cognitive behavioral therapy, or CBT. It helps people identify unhelpful thought patterns, challenge brain's distorted threat interpretations, and gradually face situations they've been avoiding, helping the brain relearn what is safe. Lifestyle changes also play an important role. Regular physical activity, adequate sleep, and reducing alcohol and nicotine can help lower baseline nervous system arousal and makes anxiety less easily triggered. And for some people, medication becomes an important tool, especially when symptoms are intense enough to disrupt functioning. A common question is, why use medication when therapy exists? Therapy works best when the brain is able to learn. But when anxiety is severe, the nervous system can be so activated that learning is hard to access, even if someone wants to do therapy. That's where medication can help. A large meta-analysis led by Dr. Hoffman reviewed 11 randomized controlled trials involving over 470 adults with anxiety disorders. The researchers found that people who received cognitive behavioral therapy combined with medication showed a greater reduction in anxiety symptoms compared to those who received CBT with placebo. They were also about 95% more likely to respond to treatment, especially in conditions like panic disorder and generalized anxiety disorder. So, for some anxiety disorders and some symptom levels, medication can lower the overload enough for therapy skills to actually stick. In moments of sudden, intense anxiety, certain medication can provide relief within few minutes. Benzodiazepines are best known for this rapid effect. They strengthen the brain's natural calming system to relieve anxiety. In the brain, GABA is the main inhibitory neurotransmitter which acts to slow down overactive signals. Benzodiazepines enhance the effect of GABA, which quickly calms the nervous system. That's why they can bring rapid relief during panic attack, acute anxiety crisis, or alcohol withdrawal. But fast relief comes with limits. With repeated use, the brain adapts. which means tolerance can develop and stopping suddenly can cause rebound anxiety. So, benzodiazepines are usually prescribed in short term in anxiety disorder. It can affect memory, especially in new memory formation, and can cause sedation, dizziness, and loss of balance. So, benzodiazepines are a powerful tool, and that's exactly why they're used with cares. For chronic anxiety, buspirone helps quiet the constant what if over time. Buspirone is a non-benzodiazepine medication used for generalized anxiety disorder, especially when anxiety is persistent and ongoing rather than sudden panic. Buspirone usually takes about 2 to 3 weeks to start working since it's designed to shift anxiety baseline over time. Mechanism-wise, buspirone works through the serotonin system. It's a partial agonist at the 5-HT1A receptor, helping dial down overactive anxiety signalings, including anxiety from serotonin neuron in the brainstem. But side effects can still happen, like dizziness, headache, nausea, or feeling a bit restless. But for many people, buspirone is a slow and steady option for long-term anxiety management. When anxiety shows up as a racing heart and shaking hands, this medication calms your body. Propranolol is a beta blocker originally used for heart conditions like high blood pressure and irregular heart rhythms. But it's also helpful for the physical symptoms of anxiety because it reduces the body's response to fear. By blocking beta-adrenergic receptors, propranolol dampens the effect of adrenaline. That means it can reduce symptoms like a racing heart, trembling, sweating, and shakiness. This makes it especially useful for performance or situational anxiety like public speaking or exams. Since propranolol targets somatic symptoms, not thought patterns, it doesn't treat the underlying anxiety disorder. Instead, it helps prevent the body from amplifying anxiety signals. Side effects can include feeling dizzy or tired, cold hands or feet, or sleep change. So propranolol isn't a cure for anxiety, but it can be a powerful tool for keeping the body steady. Psychiatric care is medical care. When stigma blocks treatment, anxiety often gets worse, not better. Understanding treatment replaces fear with facts. I hope this video helps break that stigma.